Understanding and Addressing Loneliness, a Guide for Nurses. As nurses, we often encounter patients who are not just suffering physical ailments, but also dealing with social, financial, and emotional challenges. One such challenge is loneliness. We should consider loneliness a hidden, silent threat to our patients and communities. We may even need to reconsider loneliness screening as another vital sign. Today, we'll explore its prevalence, health risks, and how you can help identify and support lonely patients. Loneliness can happen to anyone, of any age. Interestingly, defining loneliness has been difficult, but it seems to be a fluid, painful, unwelcomed feeling of subjective emotional isolation and emptiness, along with decreased enjoyment and playfulness. It is commonly accompanied by anhedonia. It may coexist and be confused with depression. Brief moments of loneliness can be normal and at times even important and inspirational, but it becomes problematic when prolonged and protracted or severely deep. Loneliness is a widespread issue. In the U.S., around 1/3 of adults report feeling lonely. It doesn't just affect the elderly. Younger adults and even children can feel lonely. Loneliness isn't just an isolated and isolating emotional state. It has repercussions in the physical, social, and financial aspects of the patients' and families' lives. It's linked to several physical and mental health problems, including stroke, heart disease, higher arterial hypertension, type 2 diabetes, functional disorders, poorer sleep, depression, anxiety, decreased personal confidence, addiction, lower education attainment, decreased ambition, decreased work performance, decreased salary, increased risk of infections, decreased ability to recover from acute illnesses, decreased medical compliance, decreased engagement and participation, 50% higher rates of mental distress, mortality rates that are 26% higher, and even cognitive decline and dementia. As nurses, you play a crucial role in identifying loneliness. Screening for loneliness is crucial and easy. What to do with the answers is more difficult, but the content and resources in this educational video aim to help, support, and assist you. Asking screening questions in a non-reactive, non-judgmental, empathetic, and compassionate way can help gain the trust they may have lost. The single-item screening question is, how often do you feel lonely? Or during the past week, have you felt lonely? There are several more detailed tools like the UCLA Loneliness Scale too. They try to measure a person's subjective feelings of loneliness and isolation. Detecting loneliness also involves understanding a patient's feelings or deficits of connection. This includes their sense of companionship, feeling left out, and their level of outgoingness. As nurses, we can guide lonely individuals. Even small gestures can make a big difference. Telling someone to not feel lonely, or that it will get better, or that it will be okay, is not very useful and, in fact, may lead to resentment and withdrawal. Acknowledging the sentiment of loneliness and offering resources may be better received and be more productive. By recognizing and addressing loneliness, you can significantly contribute to your patient's overall well-being. Encourage them to join classes or clubs, volunteer, strengthen existing relationships, and practice self-care. Encourage them to adopt a joyful activity that can give or enhance their sense of meaning, purpose, playfulness, and connection with themselves and others. There are numerous resources available for lonely individuals, some in the description below. As nurses, we play a crucial role in not just treating physical ailments, but also addressing emotional challenges like loneliness. Let's use our knowledge, abilities, empathy, and resources to make an anti-loneliness difference. Thank you.